Hello everybody, hi, I'm Jewel and welcome. Welcome to my channel. I hope everyone is doing great and doing well. Maybe feeling a little stir crazy at times like we all are doing right now, but hopefully you guys are, coping well. While you're staying in place, your health is stable, you have everything you need, your families are good. So guys, for those of us that are doing that, there are so many of us that have to continue to work outside the home. So let's give them some love and affection and send it all over the world. Because guys, like I said, I believe that love and positivity expands when you send it to other people, guys. So let's do that for all of those that are outside working without a choice and those that are sacrificing. For all of us, the police officers, the firemen, grocery store clerks, mail post office workers, truckers, garbage men, sanitation men that are picking up, all the trash. Of course, that it's even more because we're home all the time. So, guys, we have so much to be thankful for. So many people are doing their jobs well. Of course, we are staying in place because of our immune system. But I want to thank everybody for just, taking care of all the things that need to be taken care of, while we shelter in place. We send you love and affection. And of course, we thank you very, very much. Okay, guys, the topic of the day is managing medication during COVID-19 outbreak. This information is coming from the National Kidney Foundation and was written by Haley Jensen, kidney transplant recipient, and NKF patient advocate. Okay, guys, let's get started. As a kidney transplant recipient, medication is one of the most essential parts of my ongoing care. I've been very well trained since I received my transplant 11 years ago that I should never skip a dose without talking to my doctor. I take that advice very, very seriously as I risk losing my transplanted kidney if I miss a dose. Even though having a suppressed immune system is a scary prospect right now, the last thing I need is to add transplant rejection into the mix. With that said, it can be scary to think about what could happen if I cannot get my drugs because we have supply issues for immunosuppressants. I'm fortunate enough to have good coverage through my health insurance, but I'm not able to build up much of a reserve in case there's an issue with my order. A stressor in the best of times. But these are not the best of times, so it's easy to get nervous when I feel like I'm running low on doses, and that I clearly understand like all of us do. I've had a particularly complicated transition since I'm currently quarantined with my family across the country from my home in Boston. I'm feeling a little paranoid when I come to visit because the crisis picked up speed, so I packed extra medication thinking I wouldn't need it, and turns out that I absolutely did. This is a this was a big help initially as I figured out how to get regular supplies of medications in Colorado. Fortunately, I've used mail order pharmacies for years and can't recommend them highly enough, and I agree with that. It takes some time to get set up with a pharmacy and will vary depending on which service you use. But once you're set up, it's such a helpful option to avoid trips to the pharmacy, which is particularly important for at-risk individuals like me. Using mail order has helped a lot with getting my critical medications during this time. Another helpful change in recognition of these challenges is that due to COVID-19, increasing my refills to a 90-day supply for my immunosuppressants is currently an option. My insurance normally only allows me to fill a 30-day supply of my specialty medications. However, having fewer delivery interactions and more supply on hand is a big weight off my mind. I found out about this exception through NKF, which has been instrumental in advocating for patients on many issues related to kidney disease in the current crisis and educating the community about precautions and available resources. I was immediately interested and called my insurance, and after a couple of calls, however, the agent and my doctor office and with plenty of patience, I received a 90-day supply of my immunosuppressants just a few days later. Medication is the foundation for a kidney transplant recipient's care. Even though COVID-19 has presented some challenges, patience, persistence, and preparation make a huge difference. I've spent many hours on the phone communicating back and forth between multiple pharmacies, insurance agents, and physicians to figure out how to get the care I need, all of whom have been determined to help. Although it's been confusing and a little frustrating at times, everyone I've spoken to has been kind and helpful, even in the moments I've lost my cool from the stress. NKF staff has been a constant support during this time, and their dedication to hearing patients' needs and actions on them is truly inspiring. Even in the times of the unknowns, the number of people who've shown tremendous dedication to supporting kidney patients has eased my mind about getting through this crisis no matter how long it continues. Guys, this article, of course, has really touched me because it really speaks about transplant patients and their immunosuppressants. And at this time, there's many of us that are only getting that only get 30-day supply of our immunosuppressants, which is pretty normal, during a regular time. But of course, this is a crisis during, the pandemic, and the NKF, National Kidney Foundation, and many more organizations have advocated for all kidney patients who has a transplant to get a 90-day supply instead of a 30-day supply, so they won't have to deal with the pharmacies and being outside and dealing with other people at this time. So I want to say also that I'm very, very grateful to the National Kidney Foundation and the insurance companies that are allowing this 90-day supply for us. As I told you before in a video yesterday, I did not call, to get my 90-day supply, but I will be doing that when I get low on this medicine. And it is a great idea for all recipients to do the same, to talk to your doctor's office, your insurance agent, to let them know that you need a 90-day supply to keep you out of the thick of things. So guys, if you found this information useful in any way, please like, share, and subscribe. And as always, always sending all of you so much love and affection. And as you see, so especially for transplant patients, there are so many people out there trying to make sure that we are covered in every way that we need to be, especially our medicine, guys. So all you have to do is reach out if you are having any issues. So for all of us that are on dialysis, we are with you. We think about you every day because we know that you have to make that trek to the center 3 or 4 times a week, and we are sending you love and affection. And of course, for all of us as CKD patients, the only thing that we have to do, of course, is stay compliant with our doctor's orders. Listen to the CDC at this time, and of course, listen to kidney organizations, because especially the NKF, they have so much information for all of us that all we have to do is just go to their website, and they will let us know all the things that are going on in the kidney community and what's up to date for us. So guys, take care of yourselves, and I will see all of you on the next video. Bye.